Health Secretary Robert Kennedy's Senate testimony last week made one thing crystal clear. The public health system in America isn't going to become more science-based on his watch. In a Finance Committee grilling focused on his vaccine policy at the Department of Health and Human Services, Kennedy came off as downright paranoid. When Senator Bernie Sanders, who's no fan of the pharmaceutical industry himself, pressed him on his criticism of major medical organizations, Kennedy raved that they were bought and paid for by Big Pharma. According to Kennedy, the American Academy of Pediatrics is compromised because its biggest contributors are the 4 largest vaccine makers, his quote. And the American Heart Association has also been corrupted by the pharma industry. How incredibly convenient. Everyone who disagrees with him is a shill. That excuse relieves him of the burden of having to provide evidence for anything he believes. Kennedy doesn't think the Centers for Disease Control and Prevention can be trusted either. His reasoning is that chronic illnesses are on the rise, which proves the CDC leaders didn't do their job, as he puts it. He's not wrong about the increase in chronic illness, but what we know about the causes of many of these illnesses suggests that it's more likely because of lifestyle changes. Americans' diets are getting worse, we're moving less, we're sleeping less, and we're more stressed. The CDC doesn't have a lot of control over any of that. What's strange is that Kennedy himself, in the past, has identified things like food quality as massive contributors to Americans' health concerns. But this far, his total obsession with vaccines seems to be taking up the majority of his time at HHS. There are unquestionably improvements to be made in the public health system to better serve Americans. But Kennedy isn't advocating for sensible reform. He wants to burn down the entire public health apparatus and rebuild it in his image to push his anti-science beliefs. It's not just his long record of anti-vaccine rhetoric. Kennedy has displayed conspiratorial thinking on a host of issues, like suggesting that cell phones cause cancer. Former CDC Director Susan Monteraz claims that she got axed last week because she wouldn't pre-approve recommendations from RFK Jr.'s newly refilled Vaccine Advisory Committee, which Kennedy denies. We may never know whose side of the story is true, yet Kennedy clearly is on the warpath to purge the public health system of any person, policy, or idea at odds with his worldview. America needs agencies like the HHS and the CDC basing decisions on data-informed evidence. The more Kennedy opens his mouth, the more clear it becomes that he is not the man for that job.